Ever wondered about the processes inside our body that lead to insulin resistance? Well, you're in the right place. Welcome to the Victory Education Lounge. I'm your host, Maurice, and today we're diving into part 46 of our series, Cellular Mechanisms, How Insulin Resistance Develops. Before we begin, please take a moment to like this video, subscribe to our channel, and share your thoughts or experiences in the comments below. Your engagement helps us create better content and build a supportive community. Today, we're going to explore the intricate cellular processes that lead to insulin resistance. Understanding these mechanisms can help us develop more effective strategies for prevention and management. Let's dive in. In part 46 of our series, Cellular Mechanisms, How Insulin Resistance Develops, we're going to unravel the complex processes that cause insulin resistance, a condition that's become all too common in our society. Why is this important, you ask? Well, gaining a deeper understanding of these mechanisms can help us develop more effective strategies for prevention and management. But before we dive in, I'd greatly appreciate if you could hit the like button, subscribe to our channel, and share your thoughts in the comments section. Your engagement truly helps us create better content. Now let's dive into the cellular mechanisms that lead to insulin resistance. Insulin resistance may sound complex, but let's break it down. Picture your body as a bustling city, and the cells in your muscles, fat, and liver are like the city's buildings. Glucose or sugar is like the fuel needed to power these buildings. But for the glucose to enter the buildings, it needs a key, and that key is insulin, a hormone produced by your pancreas. Now imagine a scenario where the building's locks start to malfunction. They can't recognize the key, and so they resist letting the glucose in. This is what happens in insulin resistance. The cells in your muscles, fat, and liver don't respond well to insulin and can't easily take up glucose from your blood. In response, your pancreas, like a keymaker trying to solve the problem, starts making more and more keys or insulin to help glucose enter your cells. But what if the locks continue to malfunction? What if the cells continue to resist the insulin? The pancreas keeps producing more insulin, leading to an overload. Over time, this can lead to type 2 diabetes, a chronic disease that affects millions of people worldwide. But why does this happen? Why do the cells start to resist insulin? The answers lie in our lifestyle choices and our genetic makeup. Factors like a sedentary lifestyle, unhealthy diet, obesity, and certain genetic predispositions can contribute to the development of insulin resistance. Understanding insulin resistance is not just about understanding a medical condition. It's about understanding how our body works, how our lifestyle choices can affect our health, and how we can take steps to prevent or manage this condition. Now that we understand what insulin resistance is, let's explore how it happens. Insulin resistance isn't just one process, but a series of intricate cellular mechanisms. It's akin to a domino effect, where one disrupted process leads to another, culminating in a state of insulin resistance. So let's unravel these cellular mechanisms one by one. Firstly, we have impaired insulin signaling. Think of insulin as a key and the cell's surface as a lock. When insulin, the key, binds to its receptor, the lock, it triggers a chain of signals within the cell, leading to the uptake of glucose. But in insulin resistance, this signaling pathway becomes disrupted, similar to a rusty lock that can't open properly. Secondly, inflammation plays a significant role. Chronic low-grade inflammation, like a silent wildfire, can interfere with insulin signaling. This subtle, persistent inflammation often goes unnoticed but slowly chips away at the cell's ability to respond to insulin. The third mechanism involves oxidative stress. This is a scenario where the cell's balance between free radicals, the mischievous troublemakers, and antioxidants, the peacekeepers, is tipped in favor of the free radicals. This imbalance can damage various cellular components and impair insulin function. Next, we have mitochondrial dysfunction. Mitochondria are like powerhouses of our cells, responsible for energy production. When these powerhouses aren't performing efficiently, it can lead to insulin resistance, much like a city facing a power outage due to malfunctioning power stations. Then comes lipotoxicity. This occurs when excess fatty acids, the unwanted guests, accumulate in cells and interfere with insulin signaling. It's like having too many people in a room, causing chaos and disrupting the normal flow of activities. Endoplasmic reticulum, or ER stress, is another factor. The ER is like a factory within the cell responsible for protein folding. When this factory is overwhelmed, it can trigger a state of stress, resulting in insulin resistance. Finally, we have the altered gut microbiome. Changes in the composition of gut bacteria can influence metabolism and insulin sensitivity. It's like a beautiful garden turned into a weed-infested field, disrupting the harmony and impacting the overall health of the garden. So, there we have it, the 7 key cellular mechanisms involved in insulin resistance. Each mechanism is a piece of the puzzle, and by understanding how they fit together, we can gain a clearer picture of what insulin resistance truly is. This knowledge is not just academically fascinating, but it also has practical implications. It guides researchers in their quest for new treatments, and it helps clinicians provide more personalized care for their patients. Above all, it empowers each one of us to take charge of our health, because the more we understand about our bodies, the better we can care for them. Remember, understanding the mechanisms of insulin resistance is the first step to managing and preventing it. Now that we know how insulin resistance develops, how can we manage or prevent it? This question brings us to our next topic, managing and preventing insulin resistance. It's important to note that there's no one-size-fits-all solution, and what works for one person may not work for another. So let's explore various strategies that can help manage or prevent insulin resistance. First on our list is regular exercise. This can improve insulin sensitivity and reduce inflammation. But remember, it requires consistent effort, and there's a potential for injury if not done properly. So, always ensure that your exercise routine is suitable for your fitness level and health conditions. Next up is a balanced diet. Providing essential nutrients and helping maintain a healthy weight, a balanced diet is a cornerstone of good health. However, it may require significant lifestyle changes, which can be challenging but definitely rewarding. Intermittent fasting is another strategy. It can improve insulin sensitivity and promote cellular repair. But be aware, it may be challenging for some and is not suitable for everyone. Always consult a healthcare professional before starting an intermittent fasting regime. Stress management is another key factor. It can reduce levels of cortisol, a hormone that can interfere with insulin function and improve overall well-being. However, mastering stress management techniques can take time and may require professional guidance. Adequate sleep is also crucial. It supports hormone balance and reduces inflammation. However, due to work or lifestyle factors, getting sufficient sleep may be a challenge for some. Eating antioxidant-rich foods can combat oxidative stress and support overall health. However, this alone may not be sufficient to prevent insulin resistance. It should be part of a holistic approach that includes other strategies as well. Probiotics and prebiotics can support gut health and may improve insulin sensitivity, but remember, their effects can vary between individuals. Medications such as metformin are clinically proven to improve insulin sensitivity. However, they come with potential side effects and require a prescription. Always consult a healthcare professional before starting any medication. Supplements like berberine and alpha-lipoic acid may improve insulin sensitivity, but bear in mind, there are limited long-term studies on these supplements and potential interactions with other medications may occur. Lastly, cold exposure may activate brown fat and improve insulin sensitivity, but it can be uncomfortable and requires caution. Always ensure that any cold exposure is done safely. In conclusion, managing and preventing insulin resistance involves a multifaceted approach. Regular exercise, a balanced diet, adequate sleep, stress management, and other strategies can all play a part in maintaining insulin sensitivity. It's essential to remember, however, that while these strategies can be effective, they may not work for everyone. It's essential to find what works best for you. Let's bring these strategies to life with some real-world examples. Meet Sarah, a 40-year-old who has incorporated a balanced mix of aerobic and resistance training into her routine, improving her insulin sensitivity. Then there's John, a 55-year-old who has shifted his diet to include more antioxidant-rich foods and has seen a significant decrease in his insulin resistance levels. And let's not forget Maya, a 32-year-old who has introduced intermittent fasting into her lifestyle and has successfully managed her insulin resistance. These examples show that with the right strategies, insulin resistance can be managed. It's not about a one-size-fits-all approach, but finding what works best for you. Remember, understanding insulin resistance and how to manage it can empower you to take control of your health. Before we wrap up, I want to emphasize that the information in this video is for educational and entertainment purposes only. Any health-related decisions should be discussed with a licensed physician. Your health journey is unique, and professional guidance is crucial. Thank you for joining us in the Victory Education Lounge. Remember to like this video, subscribe to our channel, and share your thoughts or experiences in the comments below. Together, we can work towards better understanding